Hi, Alvin DeLeon here, and you are watching episode 56 of the 3-Minute Health Tip. And in this episode, I'm going to talk about middle ear infections. Now, if you have a child that's ever dealt with an ear infection, you can understand as a parent how disempowering it is that, they're complaining of the ear, they're crying, maybe they have a bit of a fever, there's a bit of a discharge, they're in pain, and it seems like there's not much you can do. It's a very difficult time. Well, in this 3-Minute Health Tip, I'm going to explain really the biological program involved with the middle ear infection and why it matters whether it's the right or the left ear that's infected. We're going to look at ear infections from a G&M perspective, looking at the 5 biological laws and the connections between the psyche, the brain, and the organs. And the organ affected with the middle ear infection is obviously the middle ear or the eustachian tube. The control center that's affected is the brain stem, and the biological conflict that triggers the entire biological program that leads to ear infections is what's known as a sound morsel conflict. However, it really depends whether it's the right ear or the left ear that the infection is in, because if it's the right ear that has the infection, that's known as the inability to catch a desired sound morsel. So this happens when a child is not able to hear perhaps the soothing voice of their mother when they're with a babysitter. It could be they're not able to catch the sound of a compliment, of an I love you, of a praise. When there's an unexpected event where the child feels like they miss that sound. I didn't get to hear my mom's voice. I didn't get to hear a goodbye and I love you. That could create a biological program that in the resolution, in the healing phase, will lead to an ear infection in the right ear. So it's actually in the healing phase that the infection symptoms show up. If your child has a left ear infection, it's still a sound morsel conflict, but it's an inability to get rid of a sound morsel. This is usually an undesirable sound that they don't want to hear. A baby not wanting to hear a stranger's voice, a child not wanting to hear getting criticized or being scolded or being told that they did something wrong. It's important to, again, understand when your child is dealing with these ear infections, the infection itself is showing up in the healing phase. When the conflict is now resolved, they are no longer hearing that sound morsel that they don't want to hear, which affects the left ear, or they finally heard the sound morsel that was desirable, their mother's voice, their parents came back from vacation, they heard I love you and praise again, which will affect the right ear. Again, just understanding the biological program can help in you getting to know a little bit more about your child's sensitivities and what sorts of things you need to avoid. If it's their left ear that they keep getting a chronic infection, and perhaps it's whenever they keep getting in trouble, or the way you're criticizing or scolding them is what's undesirable, an undesirable sound morsel that keeps triggering the chronic infection in that left ear. This is, again, important to keep in mind so you can create an environment that can avoid triggering that same biological program and perhaps finally allow your child to get relief from those ear infections. I hope that 3-minute health tip is valuable. I want to thank you for your attention, and I'll see you at the next episode.